We are here to celebrate Environmental Week and also so we get to know our organization, Global WaSH, which has started piloting projects in Brazil. We want to highlight the importance of thinking about the environment when thinking of One Health. I will ask you to keep your microphone off and you can have your camera on if you like to, so we can see your smiling faces. Use the chat to ask your questions to our speakers during the event. The chat, if you don't know, is just clicking the chat button at the bottom of your screen. Then it will open a small window on your right, and then you can type your questions there. And thank you so much for being here with us today. Our speakers today are Dr. Mejias, Dr. Diaz, and Dr. Perez. The agenda will start with Dr. Isis Mejias, the founder and CEO at Global WaSH, who will talk about the importance of WaSH and what we've been doing lately. Dr. Isis is a passionate water sanitation and hygiene, what we call it WaSH, advocate. She has an environmental engineering PhD degree from the University of Houston and University of São Paulo. In her research, she developed innovative nanotechnology and biotechnology process for the removal of heavy metals and pathogens from water. Our second speaker is Dr. Edgar Diaz, who is an environmental engineer and has a Master of Science degree in Sanitation and Environment from the Federal University of Viçosa, Brazil, and he got his PhD degree in Environment from the University of Brighton, UK. He's currently a lecturer in the Department of Sanitary and Environmental Engineering at the Federal University of Juiz de Fora. His work and research interests are on municipal wastewater and sewage sludge treatment and reuse, low-cost sanitation, health-related water, microbiology, and risk assessment. Our third speaker is Dr. Mario Perez, who is a researcher in the Environmental Engineering Department at Federal University of Espírito Santo. He has experience with water quality monitoring, low-cost water and wastewater treatment alternatives for remote areas and microbiome risk analysis. Thank you so much, Dr. Isis, Dr. Edgar, and Dr. Mario for accepting the invitation and being here as speakers today. I will ask Dr. Mejias to start.
Thank you, Fernanda. Thank you for that warm welcome. And I'm gonna go ahead and share my screen. All right. Can you all see my screen? Perfect. And I am delighted to be here and share with you what we have been doing so far within the organization. I think Rotarian Francis may recognize this picture, as it was shot in Uganda on our last project, washing schools. So imagine being this girl. You're barefoot and tired and have to search for water about 3 kilometers every day before you go to school. You know you have to do it all over again tomorrow. Unfortunately, this is the reality of a lot of people around the world. At least 2.1 billion people lack safe drinking water at home and 4.5 lack safe sanitation. And every 60 seconds, a child under 5 dies from diarrhea. And this is a preventable and treatable disease. It's about how long we take to brush our teeth. I mean, just very simple task that we do in a minute every day. In the early 2000s, the term WaSH, which stands for Water, Sanitation, and Hygiene, was coined by the Sanitation and Hygiene Fund. This organization was formerly known as a Water Supply and Sanitation Collaborative Council, which is a United Nations hosted organization contributing to Sustainable Development Goal number 6. This goal aims to ensure sufficient and safe water for all by 2030, and sufficient and safe sanitation for all. But it seems like we're not on track to meet this goal, because there's still a lot of people without water and sanitation access. In my experience, and what I've seen throughout the years, many projects in the field of WaSH end up failing after 3 to 5 years. WaSH practitioners and engineers, city planners are designing and implementing water and sanitation interventions. However, studies show that a significant amount of pathogen contaminated fecal waste continues to reach the environment due to inadequate containment and treatment, or because people are still practicing open defecation. Why is this happening? Well, we've seen a lot of Band-Aid solutions that are being implemented. An example, it's the famous play pump. If you guys are familiar, a long time ago with this technology that came about. There's also a lack of stakeholder involvement. The community becomes sort of, it creates a lot of apathy, and people forget about the importance of water. And then there's also political and economical issues. Projects run out of funds, etc. Because of this, in 2019, I founded an organization called Global WaSH to try to bridge the knowledge gap of what I was seeing in academia and on what in theory should be involved in project management among the WaSH researchers, and what the WaSH project managers and volunteers and all the people on the ground were doing in the field. So we are a group of people who are committed to the area of WaSH from various backgrounds and in 3 countries. We have an interesting mix of people from the environmental engineering field, the academic field, from the nonprofit field, in the humanitarian sector, entrepreneurs, and people from private industry, just that have no idea or have never worked in the environmental field before, but they understand the importance of water. What is our mission? To empower global communities with the knowledge, translational science, and delivery of water and sanitation services and hygiene. And our values are empowerment, community, cooperation, and education. As you see there from those values, a lot of our work involves knowledge transfer and learning exchange between the different groups. So how do we do it? We support local NGOs on project management. We develop research on WaSH projects, connecting theory and practice. And then we articulate stakeholders and advocacy. For example, we currently have a project in Minas Gerais in the rural district of Monteverde, where 1,300 people do not have access to sanitation and water treatment. We recently started to articulate the communication between the stakeholders to raise awareness about the water issues in the community, and start with the most basic step, which is forming a water usage committee for people to start making decisions about the governance of water. Another project we have in our organization, it's called Deworming Venezuela, and this is in collaboration with the Venezuelan Science Incubator. We have learned through this organization that focuses on neglected tropical diseases that about 66% of the population in Venezuela live in extreme poverty, if not more. These are public data. And a lot of these people are affected by soil transmitted helminths, infections, hookworms, and protozoa. So we picked several communities in the state of Portuguesa to diagnose parasitic infections among children, to implement a massive deworming treatment with ivermectin, which is a drug that it's being studied by this medical group in Venezuela, and to try to correlate the deworming, the presence of worms and of soil transmitted health myths with hand washing and hygiene, all of the access to water and sanitation services. So what do these two projects have in common? Well, both of the projects have people trapped in a cycle of poverty and disease, the cycle of inadequate WaSH services. When you don't have water treatment or sewage collection, the environment around you can get contaminated with fecal waste. You then have more exposure to infections, which leads to disability, stigma, exclusion, and higher medical costs, which eventually leads to more poverty and back to inadequate access to WaSH. So we have seen that this cycle can be broken with the One Health approach. The concept of One Health has three components: human health, animal health, and environmental health. So this approach is conceived to design and implement programs in which multiple sectors collaborate to achieve better public health outcomes. That is, professionals in animal health, the public, and the environment join forces to focus on a single health. Because when we protect one, we protect all. So this is particularly important in the control of neglected tropical diseases, which are diseases that, and the speakers coming up will speak more about this, but they're diseases that have two things in common. First, it affects most people of a certain socioeconomic status. And then second, they all have in common that they are in the tropics. So the idea is that we find common ground to coordinate, communicate, and collaborate between the three fields to achieve better outcomes. So our main goal with this webinar is to communicate that wastewater and solid waste management, that thinking about the environment will help human health, will also help animal health, that we need to think about the environment when we think of our health. So thanks for your attention. We're very thankful to share this platform with you, and stick around as we have two more fabulous speakers coming up.
Thank you, Dr. Mejias. Now we will hear Dr. Diaz talking about environmental and health risks in wastewater reuse.
Hello, everyone. Hope everyone is well. Congratulations, Isis, Fernanda, and the whole team for the Global WaSH organization and the work that you're doing. And thank you very much for the opportunity of being here today, talking to you a little bit about wastewater reuse. So before we start, Isis mentioned about water and hygiene. So let's think about our daily routine. We use water, we do wash our hands, we take shower, everything. But what happens after we flush down the toilet? Well, in urban scenarios, it's quite simple-ish. There is a series of pipes that collect the wastewater from our houses and take everything into a wastewater treatment plant that reduces the loads of different contaminants, so the water can be discharged back into rivers. And in some cases, the wastewater can be also reused. And another thing that I point out here is the fact that during the wastewater treatment, there is the production of sludge, which also has to go through treatment, and then it has to be disposed of, or it can also be reused. But what happens in rural areas? What happens is in less developed places, in emergency settings? We saw in the previous slides that in an urban scenario, it's quite simple, although, I mean, the mechanism of treatment, etc., it's quite complex. But if you think about less developed places, especially in emergency scenarios like in Haiti during the cholera outbreaks about 10 years ago, Ebola crisis in West Africa a few years back, and now COVID in some tough scenarios, it is totally different what happens to wastewater. And this is our main concern. And like Isis mentioned, about 2 billion people don't have access to clean water at home. Nearly half of the entire population of the world don't have toilets at their home. And other numbers here that I'm not going to get into details. And Izzy's also mentioned about the goal number 6 of the Sustainable Development Goals, drinking water for all by 2030, sanitation and hygiene for all by 2030. But I highlight here the last item, which is related to wastewater treatment and especially wastewater and excreta recycling and safe reuse. But we're talking about wastewater reuse. Does it make any sense reusing something that is a waste? And yes, it does, because if you think about like agricultural application of wastewater, to have a good plantation, we need basically good soil, which means soil with organic matter. We need water and nutrients for the plants. And if you think about wastewater, it's basically water with organic matter and nutrients. And so because of these factors and also growing water demand and climate changes affecting lots of people around the world, yes, there is a lot of benefits of reusing wastewater. But also there are some risks that we have to consider. Of course, there are lots of different contaminants, chemical contaminants, some organic chemical contaminants, but the focus of this presentation is on wastewater pathogenic microorganisms, which are basically organisms that can cause us a different range of different diseases. Basically, the tiny bugs that we find in wastewater and then can cause us harm. So it is very important to analyze what is in the fecal contamination of wastewater. So it is really important to understand which kind of microorganisms are there, how they survive in the environment, how we can remove them from wastewater during different treatment systems, and also how they can cause us diseases. I'm not going to detail into this table here, but there are 4 different main groups of organisms: bacteria, viruses, protozoa, and helminths, like Isis mentioned before, which again cause different diseases, different symptoms. I pointed out here the 2 main ones: diarrhea, vomiting. We probably, all of us here, had it some point in our lives, and very likely to be related to contaminated water. In a good scenario, imagine in very poor conditions how we can hit hard on people. And I think that now we reach here the main slide of the presentation, the F diagram, which is basically how feces can reach our faces. So how can fecal contamination reach us and contaminate us through a different routes? So fluids, fingers, flies, floods, and food. And if you think about wastewater, somehow it's going through these series of routes as well, because if we apply wastewater incorrectly or very contaminated, we're surely going to get contaminated as well. So there are lots of different interventions that we can do, like water and hygiene in several different points of this diagram, but most importantly, sanitation, and also much of other things that we have to apply in order to avoid contamination, which we call multiple barrier approach. It's not only about cleaning the wastewater, but also using it correctly. And if we think about it, yes, we do practice reuse every day, not necessarily directly, which is the main case of importance. But if we think that we collect water, treat it, distribute to the entire population, and then of course wastewater is produced, collected, and treated, as soon as we discharge these wastewater back to the environment, this river water can be used to irrigate crops, to swimming, to fishing, to different kinds of recreational activities. This water can also be used again to provide water for different people further downstream on the river, and etc., etc. Again, the main point here is direct reuse, the problems that it can implicate to humans, to the environment, to different animals. But of course, we have to think it as a whole, because wastewater is reused anyhow every day. So to wrap up, I have here a few questions that we have to make. I'm not going to give you the answers because otherwise I would be stepping on Mario's toes because he's talking about some tools here. But we still have, unfortunately, a lack of WaSH, lack of water, sanitation, and hygiene in several different places around the globe. Is it because we don't have enough money to improve WaSH around the globe? Or it is not really good strategy to implement these different water sanitation and hygiene programs? Knowledge and technology transferring. This is sometimes very difficult because we do have lots of knowledge, we do have lots of technology, but not necessarily we know how to transfer it from like urban scenarios, as we mentioned before, to different areas around the globe. And also wastewater reuse is not only about technical barriers, but also about social barriers. We can provide very clean wastewater to be reused, but does the population want to get a product that was produced using wastewater? Or no, it is a barrier that ourselves put just because it is wastewater. Yes, there are lots of different tools that we can apply in order to put everything to work well, like safety, sanitation, safety planning. But again, Mario is talking about these tools. My final message here would be, yes, we still have a long road ahead of us, but with some effort, we can provide WaSH to everyone. We can provide One Health for everyone, and reusing wastewater safely and correctly. We can even improve food production around the globe, especially in very poor conditions cases. So yes, I'm very confident, and hopefully being part of the group, we can move forward with all this. Again, thank you very much for the invitation, and that's it for now. Thank you very much. Questions, if you have some at the end, we're going to provide some answers. Cheers.
Thank you so much, Dr. Diaz. Now we hear Dr. Paris talking about how to reduce risks, health risk assessment and management tools.
So can you all see my presentation? Is it all right?
Yes, I
Yes,
think
great.
we're seeing the presenter view.
The presenter view. Let me check. Is it all right, or what should I do here?
You have two screens, Mario.
What?
Oh, you have two screens with you, or only one? If you have two,
I have two.
You have to share the other screen. You're presenting the main one. You have to share the other one.
I don't get what you mean.
Or you can go to PowerPoint, and when you choose, let me see how, you should be able to do it from, yeah. Okay, so cancel your screen share and then reshare your screen, but select the other screen. Yeah.
Yes.
Do you mean select the other screen? Switch, do you mean switch displays?
Switch the screen that you chose when you shared your screen, because you have number 1 and number 2. You selected one of them. Select the other.
Yeah.
Is it all right now?
Try sharing your screen.
Oh, it's not sharing. Oh, it's sharing.
Well, it's not showing anything here. I think it's not a problem if you continue like it was before. Yeah,
Yeah,
at least
fine.
I can see. Yeah.
Yeah, that's fine.
You can do it normally, Mario. No problem.
Can you minimize the thing? Or?
You mean the Zoom window? You have to do it yourself.
Oh, sorry. So I'm sorry for that. Can we
That's
keep on
okay.
like that? Is that all right?
So you have to share your screen. Right now, we're not seeing anything.
All right.
There it is.
Yes.
There we go. Yeah. All right.
Yeah, that's fine.
I'm sorry for that. So after Edgar has already presented some hazards in the wastewater, now I'm going to talk about how to reduce risks, more specifically on the health risk assessment and management tools. So why do we need to assess and control microbial risks? Actually, Edgar has already presented why we have to do that. But I hope this question is going to be answered by the end of the presentation. So one basic feature of waterborne pathogens is the ability to survive in the environment outside of a host. This is one of the main factors that contributes to the various pathways. This can include air, soil, water, food, fomites, like Edgar showed previously in the 5Fs diagram. So I have another version of the 5Fs diagram, but here in the One Health perspective, including the veterinary care, the food safety and sanitation and animal containment, water quality, personal, household, and food hygiene. And therefore, we need some intervention. So what are public health interventions? I'm going to give some examples of them, like medical care, which is essential in reducing burden of disease through treatment of disease or through vaccination, like we are having now the vaccination campaign against SARS-CoV-2. And we can also have some health education and behavioral modification interventions. Health education can be used to warn people of the dangers of risk behaviors, or can also be used to promote healthier lifestyles, etc. Then we have another intervention known as environmental control, which is used to protect the population against potential infectious agents. So we are concerned with drinking water and recreational water, as well as with the human sewage and other wastes. We want them to be dealt in a manner that is as safe as possible. And of course, some of those interventions, they can cost millions of dollars, like a large water treatment plant. And getting this support requires considerable political persuasion skills. Therefore, without political goodwill, improvements in public health becomes very harder to achieve. So let's present some health risk assessment and management tools now. These tools, they are very important to prevent the transmission of infectious disease through human to exposure to contaminated food, water, soil, etc. The first tool I'm going to present here is the Water Safety Plan, or WSP, which was developed based on the hazard analysis of critical control points approach, which is known the HACCP, which is very common used in the food industry. The aim of the Water Safety Plan is to ensure the safety and acceptability of a drinking water supply. And we have some points to consider when we want to implement it. We have first to assemble a team with all the stakeholders involved in the process. And we also have to perform a description of the system, identify the hazards, assess the risks. We have to create some improvement plan, monitoring and verifying effectiveness, and then we have to create procedures and supporting programs and keep doing the revision of the water safety plan. One important thing to mention is that there is no one way to undertake the water safety plan approach. However, when doing its implementation, it's very important that it's open and transparent. Then you can increase confidence of consumers and all stakeholders. One of the great advantages of the water safety plan strategy is that it's applicable to ensuring safety of water in all types and size of water supply systems, no matter how simple or complex they are. We can find more information about this in the manual of water safety plan, and also there is a manual for small communities. We also have the SSP, or Sanitation Safety Plan. It's very similar to water safety plan. Both of them are risk-based management tools, with the difference that the SSP deals with sanitation systems instead of water, but we have more or less the same steps. The objective of the Sanitation Safety Plan is to reduce negative health impacts related to the use of wastewater, excreta, or grey water, while trying to maximize the benefits of their use. We can also find more information in the manual that Edgar showed previously. And now I want to talk about another tool. It's known as K2P, which is actually a project. It stands for Water Pathogen Knowledge to Practice project, and has been developed by a team of experts from various universities. And the mission of this project is to provide some tools that allow access to pathogen data on viruses, protozoa, and bacteria to support sanitation safety planning, for example. And this project includes some tools and some components. The first tool I want to present here is the pathogen flow and mapping tool. This allows prediction of areas with high emissions of pathogens to surface waters and evaluate the potential impact of change in population growth, change in improvement of improved sanitation facilities, for example, and increased conveyance and treatment of wastewater, etc. All the database come from these organizations down here. And I want to show another tool, which is named Treatment Plan Sketcher tool. It allows for design of various wastewater treatment, and you can play with that. You can choose the source and then the process of treatment, and you have the output. And you have also some components in there. You have case studies where you can see examples of how to use this tool in practice. And you also have a database, which includes the data to support the use of the tools. And now I want to talk about two tools that are actually assessment tools. The first one is the risk ranking assessment. This makes a qualitative or semi-quantitative evaluation of the likelihood that a hazardous event will occur and the severity or consequence of the hazard. Then it combines them into a risk score, like you can see in these pictures here. The first one is kind of a qualitative assessment, and this a semi-quantitative assessment. So it can be undertaken at different levels of details and has been applied as a simple approach to evaluate a range of different risks in the water safety plans. However, this approach relies on expert judgment, and not all risks can be easily assessed using this methodology. So in order to support quantitative assessment of the risk, we can apply the quantitative microbial risk assessment, known as Qmra, which is a systematic, evidence-based, and transparent tool. Qmra, they were first developed to evaluate chemical risk, and then they were adopted to investigate microbial risk. And it has also its root concepts based on the HACCP approach. So to perform this, to implement the Qmra, we have a few steps to follow. Briefly, the hazard identification consists of determining the pathogens to be considered in the risk assessment and also their potential impact. Then we have to do an exposure assessment where we characterize the magnitude of the exposure for each hazard identified in the previous step. Then we have the dose responses step, which is an assessment based on mathematical models to evaluate the expected infection response based on the hazard identified. And finally, the risk characterization, where you combine all this information and you can estimate the probability of infection based on exposure and dose response assessments. So independently of the two, one key issue associated with management is what is safe. So goals need to be established early on. The formulation of the problem is critical to any risk analysis. The needs of the stakeholders and risk managers, all the needs must be considered in the problem, because the successful practice of a risk analysis requires continual interchange between manager and stakeholders. It has been already applied to assess risk in many different fields, like drinking water, wastewater reuse, recreational water, hygiene, considering different routes, etc. One of the main limitations of Qmra is associated with this poor data availability. But this tool, I think, is very useful for ranking the risks and comparing different environmental problems and different solutions, as well as different scenarios. And I see as one of the main advantages compared to risk ranking is that instead of using expert judgment, we can systematically estimate a value or a distribution of the values, depending on how you develop your model, that represents the probability of infection in a population. And then this information can be used to plan and manage public health risks, for example. So here is just a framework how Qmra could be applied to sanitation. So you can see a pathogen concentration from the sewage, as Edgar showed previously. And then you have three different files I put in here: pathways, bathing, and water for hygiene, as well as drinking water. You combine all this information with the dose response, and you do the risk characterization. So to finalize, I just want to show how Qmra can support WaSH service. So I think first it can support with a better understanding of the critical control points and transmission pathways, as along the process, you do the hazard identification and exposure assessment. And it can also help the implementation, can give new insights to support the implementation of water safety planning and sanitation safety planning as well. It can support the development of effective management strategies, focusing on systems vulnerabilities, and also the selection of most appropriate water and or wastewater treatment processes. And I think maybe one of the most important, it can help to prioritize the areas that are most in need for public health interventions. So we can go directly where it's most needed. And maybe to avoid a lot of money waste, this is most important, to prioritize which interventions we are expecting that can maximize the health gains, which is also very important. So a lot of people, they like to compare these tools. I don't think there is a better or worse tool. They are a little bit different tools, going to the same, trying to do the same aim. So I think the best is if you can use a little bit of each tool and you can do kind of a tiered approach. I think this is the best. You can get the best of all the tools. So that's what I have to say. And thank you very much for everything. Thanks a lot, Isis, Fernanda, and all the team for the invitation as well. Thank you.
Thank you, Dr. Paris. Now Isis has like something to say.
Yeah, I was going to say, so as you can see, it takes a lot of coordination to properly plan sanitation projects. We want to take the One Health concept and the tools that Mario talked about and the knowledge that Edgar talked about as well with water reuse, what is being used in academic research to humanitarian projects on the ground, to school and communities that are developing WaSH projects at a smaller scale through education programs. So if you're interested in joining our team in any way and volunteering with us, make sure you drop us a note using the form that Fernanda is posting on the chat.
Just did it. Okay, so now we're gonna go to the discussion moment. Alejandro has separated some questions from the chat, so I can ask for you. Edgar, Mario, Vinicius. We have the first question from Marina. She asked, what would be the biggest challenges of reuse in your opinion? I think this question is for Edgar.
The biggest challenge of reusing wastewater? Well, first of all, we have to start treating wastewater in areas that don't. So we have wastewater with quality good enough to be reused. After that, I think it's a matter of consciousness. I mean, we have to educate people, tell them and show to them that it is possible to do safe wastewater reuse and even improve food production, etc. And lots of different scenarios, of course, of wastewater reuse. But yeah, I think that these are the main 2 points, I would say, in terms of improving and increasing wastewater reuse.
Okay, is this where Mario wants to complement something? No. Okay, so I'll go to the next question from, just a second, from Isis. What do you think, I think it's for both Edgar and Mario, what do you think is the biggest barrier in learnings exchange?
Can I start, Mario? I think that maybe the biggest challenge and the difficulties in terms of knowledge transferring is when we deal with WaSH as a whole, we always do it in very different scenarios. If you're doing Northeast Brazil, which is a very poor area, if you compare it to Africa, if you compare it to Asia, or even in some specific places in North America or Europe, we're always dealing with very different scenarios. So what we learn from a specific case not necessarily is going to be 100% applied in a different scenario. So we always have to learn from what we do and then move on and start learn, of course, trying to get the best out of it, but also learning from different perspectives and different scenarios as well. Otherwise, it's not going to work well. Maybe one of the main reasons that WaSH hasn't been applied for all yet is these, like I said, not necessarily the lack of money, but maybe the lack of good strategy or the most appropriate strategy for different scenarios, different places. So I think that the biggest challenge in terms of knowledge transfer would be related to that. And of course, there are lots of different tools that we can apply, but maybe Mario can complement on that. I don't know.
Yeah. I think, well, I totally agree with what you said. And what I think during my PhD, I was in the northeast of Brazil, and I've been to about 10 rural communities. And I think these tools, they are here for that, you know, to help us to identify where we need to perform the interventions. So sometimes we think the problem is water quality, but like in the Northeast, when we did kind of an integrated water safety plan with Qmra, and we identified actually that the problem was more related to behavioral change and health education. So the program just went there. They placed the intervention, was in the drinking water intervention. chlorinating water. But the problem was at the household level. Actually, people, they were not managing properly the water. They are not handling it properly. So they are contaminating at the household level. So in this case, you can find it like these kind of interventions are much more necessary than water treatment in this case. So we have to educate more, and we have to be persistent. As all of them used to complain me, they just come here once, they start the program, then they never come back. So we have to go back and reinforce what we're trying to pass, what we're trying to teach them. It's not only once and you disappear and things will happen. That's what I think as well.
Yeah, I would just compliment what Mario just said. I mean, we've seen this in the social sector a lot, like people just sometimes don't trust us because we just go there once and then we just come back like 3-4 months after. And I think this is something academia and social sector could work together. So I have another question from Pedro Antonio. He asked, Dr. Diaz, you mentioned some micropollutants. Do you think they also represent a barrier for reuse, knowing that we don't have a lot of legal support worldwide?
Yes, of course. I mean, when we talk about micropollutants, there are a lot of different ones in wastewater because, of course, we use medicines on our daily routine for a different range of diseases or medical control that we do. And of course, we expel everything, or at least part of it, in our urine, in our feces. Everything goes to the wastewater. Wastewater is contaminated. And not necessarily the wastewater treatment systems that we have are capable of removing all or at least some of these micropollutants. So we focused here on microorganisms, yes, but we have to consider everything basically that is found in wastewater. And not having legal support in terms of legislation and like maximum concentrations or maximum values in wastewater or even in water is something that is a barrier for us to practice reuse and actually, depending on the scenario, WaSH as a whole, because it is still new. I mean, if you think about some different compounds, chemical compounds that we use on a daily basis, they are brand new. So we barely know them as a medicine itself. So how can we have a whole understanding on it in terms of how we expel everything from our body and how it's going to behave after wastewater reaches the environment? So yes, it is a very important topic. It is very serious in some cases, but unfortunately, there is still a long road ahead of us in terms of developing knowledge on this very specific topic.
Okay, thank you. So the next question is like the $1 million question. Why there's not enough money to WaSH around the world?
Mario, you want to go first?
Well, that's a difficult question. Yeah, it's like Edgar said previously. Sometimes it's not a problem of that there is no money. Maybe the money is not invested in the proper way. Maybe we don't study. We don't use the tools to study the situation before. We just go there and try to do some intervention, and maybe it doesn't work. And then, of course, it's going to be difficult to get more money to try more intervention. So I don't think money is the biggest problem. But of course, there is a need for more money.
I really liked something that you mentioned, Mario, which is trying to invest in areas that will bring the most health outcomes, right?
Yes.
And I think we're not doing that yet, because a lot of money goes into implementing, executing projects that maybe on water distribution, water collection, but very little in planning and understanding where the highest risks are.
Yeah, and I also think there is a lack of will of doing it correctly in terms of politicians, let's say, political will, let's say, because sometimes, like Mario said, we have the money, we have the area to be focused on, but we don't do it correctly, not necessarily in terms of lack of knowledge in terms of WaSH, nothing like that. But most of the cases, politicians, they want to do something because to get numbers at the end, numbers to be publicized, to be used in marketing strategies, but not necessarily they are good numbers for the health of the people. They're good numbers for the politicians only. So this is something that we have to consider as well. The political will sometimes is maybe the biggest barrier that we can find sometimes.
Yeah, and that's why if you are here today and you are in the environmental field, I encourage you to become an advocate, to share knowledge of what you're studying, to join any organization. It doesn't have to be ours, but any organization that it's promoting education in the issues around the world dealing with water or environmental contamination.
Yeah, okay, I think we have time for just one more question. Okay, so this one is to Dr. Paris. Have you seen the water safety plan or the K2P implemented by humanitarian organizations?
Well, the K2P, no, I haven't seen any example applied in the field, but there was water safety plan, yes. There are a lot of examples, very successful examples in Latin America and also Africa and South America.
Can you give us an example of one project in Latin America? And is there a place where we can search for more information on how this was implemented?
I can't remember the name of the city, but there is a really nice water safety plan implemented in Peru, which was, I don't have the paper here on my hands, but there is a really nice paper on that. And they have some water collection using those, I don't know how you say that, but kind of those nets you can put in the mountains area, and then can collect humidity.
Yeah, the humidity of the air, yeah.
And it's a really nice project, but I don't have it on my hands. I'm sorry.
The name is Atrapanieblas.
Atrapanieblas.
How to get fog.
All right. Atrapanieblas, that's a good one.
Do you remember the organization, Mario, that worked on this?
I can try to check it here.
It's okay. If you remember, just let us know.
All right. Thank you.
Yeah, but even having these successful scenarios previously, we have to learn from them and adapt everything for the next one, because not necessarily everything that was done before was correct over there, but not necessarily is going to work 100% in the next scenario. So I think that this is the main message that I would provide here. We have to always learn from our mistakes, but also from everything that we do right, because not necessarily on the next time it's going to be exactly the same.
Yeah, the idea of these tools is exactly that, try to help us to understand more of the situation. So we use what we have learned in the past, but try to get more information and make it better. So this is kind of.
Have you had professionals in the animal health field use the tools at all, or include their perspective in any way?
I have participated in a project some 15 years ago when I was an undergrad, which included wastewater treatment and reuse. And the treatment itself was based on constructed wetlands, which had the production of some vegetation, which we used to feed some goats. and we analyzed the quality of the milk of the goats and the feces, etc., basically the health of the animals. And at that specific project, we basically could show that it was safe to reuse wastewater for fishery, to produce vegetables, crops for humans, and also to animals, and there was no problem for the animals at all.
So
But
that's
my only experience.
no, I think it's great. It's an area of certainly of collaboration. We have also a connection with an organization in Spain called Global Bets, who are interested in participating in the WaSH concept.
Yes.
So.
Yeah, I remember one lecturer of mine back in my master's. She actually was doing a postdoc trying to apply Qmra to animals, which were eating crops produced with biosolids. So basically something very interesting. And there was a friend of mine as well that was doing her PhD on this. So very interesting things. It's quite difficult because we don't have lots of information in terms of the application of Qmra to animals. If Mario could comment on that, it's sometimes even difficult to find information to humans. So finding information to animals, it's quite a big challenge as well. So it is possible to apply all these tools that we're mentioning to animals as well, but sometimes it is even more difficult than to implementing it to humans.
Exactly.
Especially the those response models, it's impossible to find them for animals. At least I've never seen a study on that.
Yeah, the problem with the dose response models, you cannot do experiments to find out this, because you cannot get people and make them infected to try out what's the dose will do something. So it's something that comes from past studies, very old studies, and it's difficult to make more information on these things. It depends on outbreaks, and that's really difficult. This information is one of the most hard to apply Qmra.
Interesting topic for future discussion. I think it's an area where we can collaborate a lot with the health sector.
Yes, indeed.
Yes, of course.
Okay, so I want to thank you all again for being here with us today. It was a very rich discussion. I hope you have enjoyed it and come for our next section. So if you want, if you are interested in what we've been doing, you can follow us on Instagram and other social medias. I just sent on the chat our user. And I hope you have a great day. Bye.
Bye-bye.
Bye, thank
Cheers.
you all.
Thank you again. See you later.
Bye. Thank you.